The Trellis peripheral infusion system is an advanced isolated thrombolysis catheter with two occluding balloons, drug infusion holes between the balloons, and mechanical drug dispersion capabilities. This pharmaco-mechanical combination enables physicians to provide focused treatment of thrombus within a targeted vessel. The Trellis peripheral infusion system is indicated for controlled and selective infusion of physician-specified fluids, including thrombolytics, into the peripheral vasculature. The Trellis peripheral infusion system is the only isolated pharmacomechanical thrombolysis device in the marketplace today. The Trellis system comes in two sizes, 6 French and 8 French. The device has two occluding balloons, the proximal and distal occluding balloons. The labels proximal and distal are in relation to the oscillation drive unit. Each balloon is surrounded by 2 radiopaque markers, and a 5th radiopaque marker is close to the distal tip of the catheter. The Trellis system catheter has 4 lumens, 2 occluding balloon lumens, 1 infusion lumen, and 1 aspiration lumen. The Trellis system includes an oscillation drive unit, or ODU, with an integrated dispersion wire, and also includes one 30 cc syringe for aspiration, one 10 cc syringe for infusion, and 2 6 cc syringes for balloon preparation and inflation. Infusion holes are present between the 2 balloons for the infusion of physician-specified fluids. The aspiration port allows for removal of residual physician-specified fluid, for example thrombolytic, and any dissolved thrombus through a 30 cc locking syringe, which is included with the Trellis system. The oscillation drive unit, or ODU, allows the user to turn on and off the device and control the speed and position of the oscillating dispersion wire. The speed control knob alters the speed of the oscillation, which can range between 500 and 3000 RPMs. The translation bar allows for repositioning of the oscillating dispersion wire during the procedure to enhance the amount of the surface area of thrombus that is exposed to physician-specified fluids. Using sterile technique, open and pass the Trellis system onto the sterile field. Remove the catheter, ancillary equipment, and ODU from the packaging. Next, flush the infusion and aspiration lumen with heparinized saline. When flushing the aspiration lumen, place thumb over the hole at the end of the manifold while injecting. After flushing the ports, close each stopcock. For the Trellis 6 system or Trellis 8 system, utilize the 2 packaged balloon inflation syringes labeled balloon. For the Trellis 8 system, fill each syringe with 1 cc of contrast and 3 cc's of saline. For the Trellis 6 system, combine 1 cc of contrast and 3 cc's of saline into a basin. Then draw 2 cc's of fluid into each syringe. Prepare balloons using standard negative pressure technique. Close the stopcock while pulling back on the inflation syringe to keep the balloons under vacuum. Remove syringe, purge excess air, and reattach to catheter balloon ports. Keep balloons under negative pressure. Prep and drape the access site in standard fashion. Administer local anesthetic and gain vascular access. For lower extremity retrograde approach, place patient supine and access the femoral vein. And if employing a lower extremity antegrade approach, place patient prone and access the popliteal vein. A reinforced insertion sheath should be inserted and secured in place. Assess treatment location, length, and vessel size using contrast imaging. Place a 0.035-inch, 0.9 mm guide wire into the treatment location and verify the placement is successful. Insert and advance the Trellis system catheter over a 0.035-inch, 0.9 mm guide wire. Ensure that the catheter shaft is supported at the access site. Under fluoroscopy, using the catheter's radiopaque markers as guides, position the Trellis system catheter such that the treatment area is between the 2 deflated balloons. When performing the procedure on a patient with deep vein thrombosis, treat the patient's proximal section first and work distally. As a word of caution, ensure that all radiopaque markers of the Trellis system catheter are at least 1 centimeter beyond the introducer sheath tip. For the antegrade approach, inflate Trellis system's distal balloon slowly under fluoroscopic guidance. Inflate the balloon until the sides of the balloon begin to flatten against the vessel wall. The profile of each balloon will appear spherical until it comes in contact with the vessel wall or other obstruction. To avoid overinflation, visually ensure the inflated balloon material does not extend past the radiopaque markers on either side of the balloon. Close stopcock to maintain balloon inflation. Refer to the maximum inflation volume card included with the Trellis system. Do not exceed the maximum inflation volume for the size of the vessel treated. Remove the 0.035-inch guide wire. Flush the aspiration lumen with at least 2 cc of heparinized saline and close the stopcock. Under fluoroscopy, insert the dispersion wire of the ODU into the catheter guide wire lumen. Fully advance it through the catheter and attach the ODU to the catheter by tightening the rotating lure. If there is difficulty advancing the dispersion wire, inspect the catheter and/or wire for damage. In the unlikely event that the dispersion wire exits the aspiration window, pull back the wire about 5 centimeters and re-advance. Fill the 10 cc infusion syringe with the physician-specified fluid dose and dilute if necessary by filling to the 10 cc mark and attach the syringe to the infusion port on the catheter. For the antegrade approach, inflate the proximal balloon under fluoroscopy following the technique as described previously. Activate the on-off switch located on the ODU. Note the time at which oscillation has begun. Adjust the speed of the ODU per physician preference. Begin infusion by injecting the physician-specified fluid via the infusion port. Use the following infusion schedule as a guide for a 10-minute runtime. Adjust appropriately. Utilize the translation bar to achieve dispersion of the infused fluid by slowly repositioning the translation bar fully following each infusion, or approximately once per minute. Do not translate the dispersion wire more than once per minute. Continue to infuse the physician-specified fluid using the stepped infusion schedule. Continue to operate the ODU until 5 to 15 minutes of treatment time has elapsed per physician preference. Verify results with fluoroscopy and repeat if desired. Operation of the ODU should not exceed 30 minutes in a single treatment area or 60 minutes total. After each run of the Trellis system, reduce the ODU speed to approximately 1/3 of full speed. Deflate the proximal balloon when working antegrade or deflate the distal balloon when working retrograde. If aspirating, attach the aspiration syringe to the aspiration side port and aspirate by pulling back on the syringe plunger. If aspiration is insufficient, consider the following options. Flush the aspiration lumen with 1 cc of heparinized saline and retry aspiration. Turn off and remove the ODU and dispersion wire. Close the aspiration stopcock, then attach the aspiration syringe to the end of the Trellis system catheter manifold and aspirate. Continue aspirating until the desired amount of aspirate has been collected. Contrast may be injected via the aspiration port to confirm procedure results. When the Trellis system is being used with the antegrade approach, partially or completely deflate the distal balloon and, under fluoroscopy, reposition the device. Watch for any change in balloon shape indicating an obstruction that may require adjustment of the balloon inflation volume. The catheter must be supported by either the dispersion wire or the guide wire when repositioning. When the Trellis system is being used with a retrograde approach, completely deflate both balloons and, under fluoroscopy, reposition the device. Once the catheter is repositioned in the next location, inflate the balloons and repeat the treatment procedure. Turn off the ODU and remove the dispersion wire by releasing the lure lock located at the base of the ODU and pulling the dispersion wire out of the catheter. Under fluoroscopy, replace the dispersion wire with a 0.035-inch guide wire. In the unlikely event that the guide wire exits the aspiration window, pull back the wire about 5 centimeters and re-advance. Verify that both balloons have been completely deflated. Keep both balloons under vacuum by closing the stopcock while pulling back on the inflation syringe. Remove the Trellis system while maintaining guide wire access. In the unlikely event that the balloon was damaged during operation, remove the Trellis catheter with the introducer sheath. Dispose of the device per hospital protocol for biohazardous medical devices containing lithium batteries. Always refer to the provided instructions for use when operating the Trellis system. This video is intended for healthcare providers in the United States only.